This learning module will be an overview of our student nurse policy at Cox Health. We would like to welcome all students and faculty to Cox Health. We are thrilled you are here and hope to partner with you to create the best learning environment. We look forward to working alongside you to be the best for those who need us. The purpose of this policy is to create a learning environment best suited to meet the needs of our students while providing safe, high-quality care for our patients. We would like to take a moment to clarify roles for staff, students, and faculty. We want to make sure we are meeting your expectations for learning. This policy will serve as a guide for documentation requirements as well as care provision while in the hospital as a student nurse. The primary nurse caring for the patient remains responsible for the care and oversight for their assigned patients. The primary nurse is also responsible for assessment of their patients. This assessment must be documented in the electronic medical record by the RN caring for the patient. Reviewing the patient's plan of care and priorities for care should be a shared responsibility between the primary nurse and the student and/or faculty. The primary nurse may co-sign documentation if they observed the nursing care being provided by the student that requires a co-signature. For capstone students, the Cox Health RN should perform professionally as a role model for the student nurse. This includes a teaching role with active communication and feedback regarding the student's progress. Communication with off-site faculty is necessary to ensure the student is meeting all objectives. Nursing faculty share the responsibility with the staff nurse to ensure our patients receive safe, high-quality care. Faculty members are responsible for providing the appropriate level of supervision for students. Faculty members are responsible for communicating and collaborating with the charge nurse to ensure appropriate patient assignments are made and follow-ups as needed. When observing students performing nursing care that requires a co-signature, faculty are responsible for completing the co-signature in the electronic medical record. Faculty members are responsible for following all institutional policies and procedures while supervising students. For observational or capstone students, nursing faculty may not be present on site the entire time a student has a clinical experience. They should be responsible to make sure the charge nurse or preceptor knows how to contact them in case a need arises. Communication of expectations, objectives, and requirements are very helpful to improve the learning experience for the student. Nursing students are responsible for their own actions while on any Cox Health campus. Students should come to the clinical experience ready to learn and excited about all learning opportunities. Nursing students are responsible for conducting themselves in a professional manner. This includes appropriate attire and use of their ID badge, as well as professional and courteous language and demeanor. Nursing students should introduce themselves to the nurse caring for their patient and maintain that communication throughout their designated shift regarding patient changes, patient needs, the plan of care, and expectations for the shift. Additional nursing student responsibilities include discussion and agreement with the primary nurse regarding what care the student nurse will be providing for the patient. The care should be provided within the scope and level of the education of the student nurse. Students may only perform skills they have been taught in their nursing program. Exceptions are made only by permission and observation by the on-site nursing faculty member. Student nurses are allowed to document the following care without an RN co-signature: personal care such as bathing, oral care, catheter care, intake and output, meal intake, and vital signs. There is a student nurse folder. It's available by clicking on the ad hoc button in Cerner. This will be reviewed in a later module. Care provided by and documented by a student nurse that typically requires an RN must have an RN co-signature from a supervising RN. This includes the activities listed on this slide. Co-signature may be from the primary nurse or the faculty member. Prior to student documentation, the student and RN or faculty member should discuss and agree to the need for a co-signature. All documentation requiring a co-signature must be co-signed by the end of the shift. This should be discussed and planned ahead. Student nurses are not allowed to perform the following activities: initiate power plans, initiate or update the plan of care, document medications by history, complete admission interview 1 or 2, add or change allergies, take verbal or phone orders, perform computerized order entry, discontinue orders, document skin risk assessment, document pressure ulcer wound care, restraint documentation. They're also not allowed to provide moderate sedation, provide parenteral chemotherapy, set up or program a PCA or epidural pump, administer blood or blood products, or pick up any blood or blood products from the blood bank, or receive report on patients coming from surgery or procedural areas. They may listen in to report, but cannot be the primary person taking report. If there's ever a question about what a student nurse is allowed to do, it's always appropriate to consult with the primary nurse, charge nurse, or nurse manager. If students are in a clinical rotation where medication administration is allowed, they must follow Cox Health medication scanning policy. Faculty members may check out a medication scanning device from the Springfield Nursing Operations Office for use during the clinical rotation. Medication scanning devices must be checked back in after the shift is over. For students with clinical rotations in areas with tethered scanning devices in the patient room, this is the preferred method for scanning medications for students and faculty members. Students in Branson clinical rotation sites will use only the tethered scanning devices. For additional information or to review this policy, please see Student Nurse Guidelines policy located in Policy Manager. This is the completion of the review of the Cox Health Student Nurse Policy. Thank you for taking the time to review expectations with us. We hope your clinical experience at Cox Health is a positive and fulfilling learning opportunity. We thank you for the excellent impact students make on our culture and our patient care. We appreciate having you here to help us meet our mission. Thank you.